I'm Dr. Ryan Zeronis. This is Dr. Dayna Socha. We're with Align Your Spine Chiropractic, and we specialize in sports and wellness care. Most major athletes, if not all, utilize chiropractic care. And what we're going to stress today is the importance of chiropractic care and the strength of the core and how it relates to your sport specifically, but also to overall health and performance. Do you have anything you want to add to that? Okay. Well, just about every major team out there that plays professionally uses chiropractic care, and that's for a few reasons. One is because we get you back into the game once you're injured faster than anybody else you can, really, without surgery and without drugs. Surgery lays you up for weeks at a time. Unless you have a full-blown rupture, it's usually taken care of with conservative care, and pretty well. The other reason is because it keeps you performing at an optimum level all the time. And once I explain really what it does, you'll understand that. Because right now you probably won't really see what I'm talking about. Feel free to chime in wherever you want to.
Okay.
Because I'll just keep going. Today we're really focusing on the core and core strength and why that's important. What your core is, it's the core, it's the center, it's the foundation. The core is the entire midsection of the torso. It's not just like the six-pack abs. If you think about a core, like if you're putting a tree stand up for your kids, we may use a really strong, robust tree. If you hunt, deer stand, you want to use a good tree. The roots need to be strong, that's your legs. But the core is what you attach everything to, that tree. That's where the house is actually built. And that's the same thing with your core and your body. Your axial skeleton is your ribs and your spinal column, basically. Everything else attaches to that. So if there's an issue there, you're going to have an issue out farther in the extremities. So what you really want to do is build a good foundation of the core and the legs, and the rest of your body kind of follows. The rest of your body follows your head typically. And the reason for that is because it's attached to the cervical spine, and the rest of the spine goes down through the body with rotation. The thing is with your typical core training is it's usually flexion and extension, crunching a lot. That is very dangerous because of what it does to the discs in the spine. I did not bring the spine model, either of them. But the discs are wedged through the spine. And have you guys ever seen a spine? It has a couple curves in it. So flexion and extension delaminates the disc. You guys are familiar with newtons and pounds per square inch as far as pressure goes. Well, when you flex over the spine, putting thousands of newtons, which is the equivalent of even thousands more pounds per square inch of pressure, through that disc. When you flex forward, there's only one direction for that disc to go if it herniates, and that's toward the spinal cord. Same thing, right? You get that. So these are naturally wedged in a certain position to give you that curve in your spine, otherwise it would be a straight column. The reason there's curves in the spine to begin with is to absorb shock. If you can't absorb shock, things break. Limitations of matter. If you flex a pencil or a stick, it'll flex. If you flex it a little bit too far, you reach the limitations of the matter and the pencil breaks. Same thing is true with your muscles, ligaments, and bones. In this case, the disc. Flexion and extension. Research tells us you have 18 to 20,000 flexion and extension cycles before you completely delaminate the disc, which leads to herniation. That's what you don't want. People that do these 500 crunch workouts 3 times a week really chalking up the numbers by the time that they're 30. You don't usually hear people blowing a disc out or slipping a disc lifting weights. It's always, I bent down to tie the shoe, or I picked up the cat. Because it's basically the straw that broke the camel's back. You're born with like a piece of chalk, let's say, and you take swipe after swipe after swipe. Well, eventually you're going to run out of chalk. How fast you do that is really up to you and your biomechanics, how you move. What we're going to try and explain today is the proper way to train core without using flexion and extension. Because believe it or not, this really doesn't do a whole lot for core strength anyway. The idea behind the core is to stabilize, not flex. The core transmits the force. The spine should never generate the force, it should transmit it. It's generated here or here, not here. This needs to transmit that force from here. If you're throwing a punch, it comes from the hips. It doesn't come from the spine and the pec. It comes from the hips, and this is all follow through. Same with a baseball pitch or really anything. Stabilization. And the reason we want to stabilize the spine is because this is a cylinder, that's your core. So if you stabilize the spine, you stabilize the rest of the body. It's very important to do that because the spine is, the vertebral column is bone, very strong, and it protects a conduit of billions and billions of nerve tracts that come from your brain. That's called your spinal cord. So your brain sits up here and it's fully encased in bone too, one of the hardest substances in the body besides tooth enamel. Very important stuff, very sensitive. You know, dangers of concussions and things like that, gunshot wounds, not good. Nervous system is very delicate, but it controls everything in your body. So it's very important that it's stabilized and strong. So when the core is active and it's doing what it's supposed to do, it stabilizes the vertebral column. The vertebral column protects the spinal cord. That is really what it's all about. It's not really made for twisting or anything else. It's there to absorb shock, give you your upright posture, and protect the nervous system. It's also what generates and transmits force. So that's really the importance of the core. And it's kind of confusing, but once we explain the rest of it and you see some of the exercises, it'll all kind of come together. So this will probably be a place where we would edit so I can think of the next thing.
Do you guys have any questions so far?
Yeah, as I was growing up and stuff, like something me and my grandpa always did was we did a lot of crunches like before bed, and that did that for like maybe 10 years, like every single night. And I looked at an X-ray like maybe when I was 19. I had past evidence of like Scheuermann's disease and some disc compression, like this way.
In the thoracic spine?
Yeah. So so I guess I see like where that came from. Could that be it?
Scheuermann's, it could be a contributing factor. It's kind of idiopathic as far as pathogenicity. They're not sure really what causes it.
Yeah.
Did you have Schmorl's nodes?
This said past evidence of it.
Okay.
Yeah. With Sherman's, it's just micro traumas over and over and over again.
Yeah.
So that could be something that you were going through, especially being at a young age, your body's not fully developed yet, and you're putting all those micro traumas in your body, doing crunches over and over again.
Okay.
So it could be something like that.
Yeah, repeated micro trauma. And posture is a big one when you're a teenager. How old are you now?
23.
Okay. Yeah, a lot of the kids nowadays, they're always on their phone, they're hunched over like that. And they kind of look like a 70-year-old woman would, you know, with that dowager's hump. And they're going to grow up like that. Usually you get that when you're older in age and you're osteoporotic and you develop that bad posture. So that's a lot more common now than it used to be, Sherman's, because of the whole posture. Crunching is a very bad thing because you're taking out the curves out of the spine. And like you said, when you do that at a young age, you can't really adapt to it like you would if you were had a mature skeleton, because you're still developing. Your growth plates stay open until you're in your young 20s. So the damage you do there, you can't fix. So you really want to stay away from the crunches. At this point, you learn something new every day. Don't worry about it, move on, just do it properly from now on. And you'll find that the more you train your core properly, the stronger you'll get. It prevents you from getting injured too. Remember, we want to stabilize the spine. That's why you see those weightlifters that wear the belts.
Yeah.
All the bodybuilders that we train, we don't let them use the belts. Belts are like crutches. Same with braces. If you really need one on like 1 or 2 really heavy lifts, fine. But if you start depending on them, just like guys who use gloves to lift. I use gloves when I lift. My hands stay soft because I'm always touching people. But if I use them, well, I need them now. Otherwise, my hands get tore up. I get blisters from doing curls. You know, I don't want that crutch around my core. The core needs to be strong no matter what. Your wrists need to be strong, especially in what you guys do. If you're always wearing a brace, you're limiting your range of motion, therefore you're limiting your potential. Limitations of matter again. The idea behind the brace and the back belt is you're supposed to push out against it. Most of these guys tighten them down so hard that they squeeze the core, and the idea behind it is not to squeeze the core, but for you to push out against it in all directions. That's what stabilizes your lumbar spine. It's very important that you breathe properly. You want to belly breathe, not paradoxical breathing with the ribs and the upper chest. Because the diaphragm, when you belly breathe, comes down a little bit farther, almost into the lumbar spine. And that stabilizes part of the lumbar spine and also the thoracic spine. So really, when you're in proper form and you're breathing properly, you really have a strong stabilization here. But most people don't do that. That's what leads to injury. And when you slip a disc, or you subluxate, which is when 2 bones misalign, you start getting muscle spasms and nerve interference, because the reason your body protects the nervous system the way it does is because it is very sensitive, and for a reason. The nerves are paramount to your health and your wellness. As you know, they control everything. They control your pain, what you perceive, the function, muscle strength, digestion, everything. So if you keep the stabilization proper, the juxtaposition, which is proper position, will have a better chance of staying proper also, therefore decreasing injury. When you already have a subluxation or a misaligned bone, it doesn't take a whole lot more to really injure yourself, even if you're using good form. The idea is to have proper spinal alignment, proper stabilization in the core, proper form. You're a lot more powerful, you're a lot less prone to injury, and you recover a lot faster. If you think about what your nervous system does for your body, when you eat good food, those nutrients go in, they get digested. They get digested because your nervous system tells your body to digest them. But then it also tells your body what to do with the nutrients once they're in the bloodstream. And you have a little bit of vitamin C going to your retina in your left eye. Something you would never even think about. If you have too much vitamin C or vitamin B, it comes out in the urine, you get that bright yellow urine from too much vitamin B. How does your body know to do that? Constant communication with the brain and the body. Constantly. If you get a cut, it heals. Band-Aid doesn't heal it. Broken bones, casts don't heal them. They just line up the tissues. The body knows to heal it. It's all nervous system, and it's always firing, and it's always relative to what's going on in your body. That goes back to proper spinal alignment. If you keep the bones aligned, you don't have interference farther down the chain. It's like stepping on a garden hose. If you step on the garden hose, you're going to have interference with the water coming out of the hose from here on down. So if you have an issue right at the spout, in this case it would be the top of the brainstem, misaligned bones in the neck, you're going to have issues, whether or not you feel them or not, all the way down the chain. You may not digest your food as well as you could. Your muscle soreness may not go away as fast as it would if you had proper alignment. Because healing is what the body does best. The only way you heal is with the nervous system putting the nutrients you eat to use. So you really need proper spinal alignment, you need to stabilize that area, and you need to move properly. All three of those are just about equal. Because if you move properly, you're going to misalign the bones, which puts tension on the nerves, tension on the muscle, therefore predisposing you to injury. If you're already predisposed to injury and you don't move properly, you're going to get hurt. It's just a matter of time. Maybe it's a slip disc or just a sprain strain, but really it's just all biomechanical. And it makes complete sense when you really think about it.